Most patients think improving a smile automatically means veneers. Cosmetic dentist Dr. Pamela Vranis weighs in on smile enhancement options from simple whitening all the way to full veneers. Stay with us until the end when she reveals one of cosmetic dentistry's best kept secrets for enhancing a smile. It's something most patients barely know exists. We're really excited to have you weigh in on different smile enhancement options. So let's start out with your thoughts on just teeth whitening.
Teeth whitening is truly one of the first questions I get asked. It's hot, it's a trendy topic, and there's also an array of methods used out there to whiten teeth. You can start with anything as simple as just whitening toothpaste, which is very conservative. You're probably going to get the least bright result, but it's a great place to start. Most whitening toothpaste you can use every day. And then we move on to the whitening strips, which of course you can get over the counter whitening strips, or you can get prescribed from your dentist whitening strips. And those tend to be about double the concentration of over the counter whitening strips. So those are great, but their way of use is exactly the same as over the counter. Another option is a syringe that you can make whitening trays custom to you through your dentist. And you then buy also the whitening syringe, the gel that you fill your whitening tray with and just wear it as if you're kind of wearing a night guard or a retainer. And you've got the gel in that tray and of course up against your teeth. The final and biggest bang for your buck is the in office. The final and biggest bang for your buck whitening technique is in the office. So you go to your dentist, and you pretty much sit there for about an hour and a half, and you get the most potent whitening gel placed on your teeth by your dentist or the assistants. And that usually tends to be the highest concentration of whitening. So you'll get the best effect. That's great for before a wedding, before an event, where you really want that white smile and the biggest effect.
Are there risks with over whitening your teeth?
The biggest risk is just getting sensitivity. That's the biggest risk. Whitening is a soft acid. So while it's great to get out the stain from wine or teas or blueberries and smoothies, it is a soft acid, so it will dehydrate your teeth and leave you with some sensitivity. Granted, that sensitivity is temporary. So it's not going to last forever, but it takes maybe a couple days. But it's really the only side effect of whitening.
Okay. I've done lots of teeth whitening over the years and have had sensitivity, but it
It's
does.
common. It's common.
Okay, great. On the theme of smile enhancement options, a little different than teeth whitening, are most patients think improving a smile automatically means veneers. Cosmetic dentist Dr. Pamela Vranis weighs in on smile enhancement options from simple whitening all the way to full veneers. Stay with us until the end when she reveals one of cosmetic dentistry's best kept secrets for enhancing a smile. It's something most patients barely know exist. On the theme of smile enhancement options, a little different than teeth whitening, are aligners.
Aligners are also very trendy, and they're getting to be more popular with adults. Usually we find orthodontia to be a childhood, a teenage thing. And now more and more adults are straightening their teeth, maybe even doing a round two treatment where they had braces and Invisalign or traditional braces in their teenage years. But then things shifted. Maybe they weren't wearing their retainers, and they kind of want to go back and do aligners. There are many types of aligners out there. Invisalign being the most reputable and most commonly used jargon. out there. So that's become very trendy. And also since they are clear, they are easy to wear in adult life while taking meetings, being a parent, being on Zoom calls, and not feel like eh, it's the only thing that someone can look at, like traditional braces.
Yes, I've had braces twice and done aligners twice. And with the aligners, we got to a point where we just couldn't, you couldn't move the tooth really. So, are there limitations like that? Keep
There
on.
are limitations with any option. Some movements are just easier physically, mechanically with braces. And then other movements are easier with aligner trays. And some options move teeth faster, others slower. Aligners tend to move teeth slower. So things can be a lot more predictable rather than with braces, it's tightening a wire and it just has less predictability. But maybe the movements, you can do more movements, maybe with traditional liners or just different kinds of movements. So yeah, all methods, braces, lingual braces, which are braces on the inside of your teeth, and aligners. They're all different methods, but and they're all tailored towards specific needs, lifestyle, movements, anatomy. There's a lot of factors that play into treatment with orthodontia.
Have you ever seen someone where kind of have like a black triangle in between their teeth? How do you address that? Stay with us until the end when Dr. Vranis reveals one of cosmetic dentistry's best kept secrets for enhancing a smile. Have you ever seen someone where kind of have like a black triangle in between their teeth? How do you address that?
Totally. We also see that a lot. It's become something that we're seeing in our more aged population. They usually with gum recession, that black triangle, so that distance between where your teeth touch and your gums, that is that black triangle. And usually they're in the front teeth. The gums tend to be a little bit thinner and more sensitive to gum recession in those areas. And of course, they are the most visible areas. So it is in line with gum recession. So with these black triangles, we can do one of two things. Usually, a good option for some people would be to do something called gum grafting, which lowers your gum line and fills in that black triangle area with gum. And that's done usually by a periodontist, which is a gum specialist. And they're very well trained in doing gum surgeries like that. Another option would be if you don't want to go through a gum surgery, which is pretty painful. I have gone through it myself, is just composite bonding. So adding a little bit of composite material into those black triangle areas on both sides of the teeth can help change the visual and make it appear like that black triangle is not as big. So we can reduce that black triangle size down to being a little smaller and less noticeable.
That sounds like a beautiful result. My friend has had her black triangle for years and she's had gum surgery, and I feel so bad for her, but it sounds as though there's an easy solution.
Less invasive, definitely less invasive and quicker. Maybe more prone to needing to change it out in the upcoming years, but less invasive and reversible.
Someone else that I related to, she has just tiny, tiny baby teeth. I mean, is it possible to make teeth bigger?
Yes, absolutely. Absolutely. Peg laterals is what we call those baby teeth. They're usually right next to the two center front teeth, and they are a developmental effect where those those lateral incisors just grow in a little smaller. And it happens, and it can happen on both of them. It can happen just on one of them. It's a developmental, and usually it's just how they grow in. So by adding with composite material, by adding material onto that existing tooth, which is smaller, we can build a regular size tooth that matches the neighboring teeth and make it appear like it's totally normal from the front.
Do you have to shave those down a bit?
Not at all. Not at all. Nope. You don't have to change the neighboring teeth at all. It's very conservative. We just work on that peg lateral, on that tooth itself. And with bonding techniques, we just add material to it.
Okay, how fantastic. Okay, I'm going to let her know. I'm so glad we're talking. And now I'm thinking about my sister who throughout her whole life she has kind of this stain on her teeth and it was from some kind of medication when she was younger. Don't leave before Dr. Vranis reveals one of cosmetic dentistry's best kept secrets, something most patients barely know exist. And now I'm thinking about my sister who throughout her whole life she has kind of this stain on her teeth and it was from some kind of medication when she was younger. So that's
An
something
antibiotic,
I think so. Keep on.
tetracycline,
Yes. Yes.
also very common. And as we've become more educated in seeing the effect of it years later, we have learned that tetracycline, the antibiotic, actually causes permanent intrinsic staining to the permanent teeth, to the adult teeth. So you want to be really careful if you're pregnant not to take the antibiotic tetracycline. You also want to be really careful up until about the age of 8 for your child to not take the antibiotic tetracycline. It's something that we can correct through, again, a wide array of methods that we use, one being veneers, lab made veneers, and one being composite bonding that we use. And it just depends on the depth of the stain, how mild it is, how severe it is. A more mild case where there's just faint discoloration, we could do composite bonding. If that stain is just a little bit more, a little deeper, a little bit more tenacious, then we would go and move, and we would want to move to a lab made prosthesis, a lab made veneer to really make sure that that discoloration is not showing through the work.
Okay. My sister did get something done and she always has problems with it chipping off. Is that a risk of the treatment?
Yes, it is a risk of the composite bonding. Unfortunately, while it's very conservative in nature, non-invasive, the risk or the downside effect of it is that it can chip a little easier than a veneer can. However, a veneer, a lab-made veneer, can also chip. Maybe a little less prone to chipping, but it can chip. You do want to be careful with any kind of composite bonding or lab made veneer. Any dentist will tell you that if that material is added on to the edge of the tooth where you bite into things, you want to be very, very careful to not bite into anything hard. Apples, corn on the cob, those are just things that you have to be aware of for the rest of time.
Okay. So maybe she had them kind of put under on the bottom of her teeth or top of her teeth.
Yep. We call those the incisal edges, but yes, they are on the bottom of the teeth, closest to your other teeth.
Okay. Yes. And if you're chopping on popcorn seeds, that is probably gonna chip.
Oh, yeah, definitely. A popcorn seed can chip a back tooth, a molar. So it can definitely chip off anything made in the front, which is thinner and more delicate. Be careful with them.
I know exactly. Oh my goodness. What about, oh gosh, they're the most beautiful smiles on earth, but they tend to be more gummy. Beauty seekers, we appreciate you joining us here for this interview with Dr. Vranis. If you like the education we're sharing, please subscribe to Beauty Seek. Gosh, they're the most beautiful smiles on earth, but they tend to be more gummy. Is that something you work with?
Totally. Gummy smiles are really challenging to work with. They show everything. And that's what even a patient with a gummy smile will say is that my teeth always have to be clean. My gums always have to be not inflamed because they show. They show. So if we do any work on the areas closest to the gums on someone who has a gummy smile, it is so important that everything is perfect because it's going to show when they talk, when they smile in photos. They'll see it first thing front and center when they're looking at themselves in a mirror. So we really want to pay close attention to the polishing techniques that we use in cases like that. So if we were to, for instance, put a little bit of composite bonding near the gum line, that that has to be done to perfection. It has to be so smooth. It has to be thinned out as it approaches the gum line to not allow for any inflammation towards a gum line. Same thing with a veneer, a lab made veneer. That has to be done so thinly and flushed against the gum line because everything's going to show. And you really want to make sure that when you're preparing the teeth to add the composite bonding or to make a lab made veneer for that trimming and contouring of the tooth is done in a way that it's below or in this case above the gum line so that it seems totally flushed and uniform as you go up against the gum line because it's going to show. It's so obvious and evident with a gummy smile.
Okay. And then does that kind of get rid of the gummy look, or is that
You can, so that is a whole other thing, which is so fun, where we actually can raise the gum line up and create a longer tooth look. That's really fun. And that's also done by a periodontist, a gum specialist, where they can do something called a gingivectomy. So they cut the gums and recontour the gum line. So the scalloping line changes from maybe being a little lower to a little higher. And therefore, maybe, especially on the severity of the gummy smile, if it's not as severe and the lip line, the upper lip is only about a millimeter from the scalloping of the gums around the teeth, then that's something that's probably very correctable with a little bit of gum contouring with that gingivectomy process. So that's really exciting. Or if there's a more severe case where there's just a gummier smile, it can always be reduced, which also looks really good. And patients notice that change. A millimeter goes a long way in the mouth. Every millimeter counts.
okay? That's great to know that there's this because they're the most beautiful smiles that I've ever seen. It's just, we've got this kind of gummy feel, and humans for some reason don't like too much gums.
And
So
usually
yeah,
patients with gummy smiles have the brightest smiles because you see so much. You see so many teeth, you see the gums. They tend to be really happy smiles. So it really does make a difference when you can help them achieve a goal of theirs, which is just to show a bit more teeth and less gum.
if teeth whitening, maybe some aligners, some reshaping, gum grafting, all of that is maybe not enough to get a beautiful smile. There's enough issues. What would we move into for a suggested solution? Or keep watching. Dr. Branna shares what she has seen change smiles the most. So it's teeth whitening, aligners, maybe some tooth reshaping, some of those solutions, addressing the gums. if that doesn't necessarily allow for the most beautiful smile that we want, there's like bigger issues potentially. What would you suggest to a patient?
A great suggestion would be, and a great option, are lab made veneers. They are the traditional veneers that we all know and see on TV. They are facings, so they just go around the front of the teeth. And they're great options if you really want to change your smile and are really convinced of it. I say that because most times for veneers, we have to trim down our teeth a little bit in order for those veneers to then stick on top and not look and feel bulky. So those are great. Veneers are great options, but they are what I like to say irreversible options. You can't really go back. Once you trim down that tooth on that front surface, then you will forever have to have veneers. So it's something that you really want to consider and talk through with the patient extensively and have a full treatment plan and even show them an after photo of what they're going to look like with a veneer or veneers, because usually veneers are done not just one tooth at a time, but either two, four, or six. So veneers are great options, but what I like to tell patients is that it can be an irreversible option, given that we have to shave down the teeth a little bit on that front side of the tooth in order for the veneer to pop on and not look bulky. It's an option that is great and it changes the shape, the shade, the uniformity of an entire smile, depending on how many teeth the patient and the dentist decide to do. It can be one tooth, two teeth, four teeth, six teeth. That's usually the amounts. Usually we do it in pairs, working from the center and outward towards the canine. So it's an option that certainly changes the look of a smile and has a lot of potential, but it is irreversible. So the patient just needs to know that and be really convinced that that is what they really want to do.
So they only go in the front of the teeth?
Yes, they only go on the front of the teeth as opposed to crowns, which we can definitely talk about crowns because there is a difference there. Veneers only go on the front of the teeth and they wrap around a little bit over that incisal edge. And so there is a small amount of veneer on the back side of the teeth, but the purpose of them is to be a full facing of the teeth. Yeah.
So will you okay, if they go around the tooth, will you feel it with your tongue on the inside?
You do, and that's something that patients do notice. They're like, "Oh, I feel a little ledge on the insides of my teeth now," and they get used to it. It's flushed against there. It's just different at first, but it's totally flushed, and actually, the more wraparound it has, the more retentive it's going to be. Meaning, the less likely they're going to chip, flick off, fall off. So they're actually better for the longevity of them to have a little bit of a wraparound rather than just being just a front facing.
Okay. And you referred to lab made as opposed to how else would they be made?
Chair side.
Oh,
There, yep.
okay. We'll have to get there. So let's talk about the colors. If you're only doing two, how do you make that work with all the teeth that have are probably various colors? Keep watching. Soon, Dr. Vranis is going to share what she has seen change smiles that most people think can't be fixed without surgery.
Shade is so important when you're doing a veneer or a crown. Anything in the front, shade is highly important. Teeth naturally have about three shades to them. So you'll have a different shade near your gum line, you'll have a different shade along the body of the tooth, and then you'll have a different shade along that incisal edge. So when you're making anything, and especially if you're sending it out to the lab, a dentist is usually also taking photos and making sure that the lab can really get of the visual of the patient, their their entire face, zoomed in photos of their teeth. You really want the lab to have as much information as possible to make the best veneer, especially if you're doing 6 veneers and you're really changing your smile line. The lab needs a lot of information. Now, if you're just doing one veneer, us dentists always say this, one veneer sometimes is harder to match a shade to than 6, because all 6, you're going to make them the same or you're going to feed off of the other. But when you're just trying to match one to the neighboring teeth, and like you said, a lot of times those neighboring teeth have all of these different shades. The first and foremost thing that you should do is, or that a dentist should do and explain to the patient, is actually whiten your teeth. Whiten the teeth. Yes. The more accurate of a picture that we have before starting to shade match, it is really important. First of all, patients might have some staining on their teeth. They should get a cleaning and they should get their teeth whitened to make sure that then we are matching and we're making that veneer or those veneers as accurately based on their most whitened teeth, because a veneer won't whiten. So if then someone goes to whiten their teeth afterwards, that's not going to, the veneer is not going to whiten, and so it's going to then look a little awkward. So you really want to match up that veneer shade with the whitest teeth that the patient can get.
That makes sense. And especially what you said about one tooth. I mean, I think I can just remember smiles throughout my life where one tooth that was different from all the rest just really stood out.
Totally.
But if you're so the challenge with veneers then is you always need to keep your teeth as white as you match the veneers to.
Totally. Which is also a healthy habit to get into, not necessarily the whitening, but it means you're having excellent hygiene at home, which is really important for maintaining the veneers. It means that you're going to the dentist for your cleaning 3 times a year or twice a year at least. It does promote good hygiene and good veneer etiquette.
So before we move on, because I'm very interested in crowns as an option to veneers, what questions should a patient be asking of their dentist as they're trying to determine if veneers are right for them? Beauty Seekers, we're so happy you're here for this interview with Dr. Vranis about veneers and enhancing your smile. If you would like more education about aesthetic procedures, please subscribe and we'll be sure to do more interviews like the one we're doing today with Dr. Pamela Vranis. What questions should a patient be asking of their dentist as they're trying to determine if veneers are right for them?
Great question. First off, if they are good candidates, meaning are their teeth strong enough? That's first and foremost. Can they maintain, can they stay strong during the process? So there is going to be a little bit of drilling. So you really want to make sure that their teeth are healthy enough and in good status, in good condition to go through that process. You also really want to be asking the questions of why a veneer versus a crown? What's the difference? How does will my bite fare well with veneers? A lot of times we do hear about veneers popping off. And that has a lot to do with not just the technique of how that veneer was made or what material was used, but also how that bite comes together. And is that veneer constantly getting pushed out by the lower teeth? So, and another good question would be if a patient would have to wear a night guard. So asking, hey, how do I maintain my veneers so that they last for as long as possible? How do I clean them? How do I need to wear a night guard to make sure that I'm not grinding at night and causing them to loosen and weaken and then more prone to fracturing or popping off.
Okay, that's great. And how long can veneers last?
They depending on these factors of that bite, the maintenance of them, good hygiene, they can last decades. I work on patients where they have had veneers for 40 years and they've never changed them out. So it really depends on factors like how they're maintaining them, like I said, how that bite what is so that they're not constantly coming into contact with them, and of course how they were made as well does make a difference. They do need to have some strength to them and therefore some thickness to them, which in turn means that to have more thickness on the veneer, the tooth would need to get shaved down more. So to get more thickness of that material, the thicker the material can be, so like half a millimeter versus 2 millimeters, is quite significant in lab made veneers. And a 2 millimeter veneer is probably going to last longer than a half a millimeter veneer. While a half a millimeter veneer looks really good and it looks probably more natural, that's where that technique and that lab quality makes a big difference. Because if you're using good material, you can have a thicker veneer and still look very natural.
Okay. And I had such a good friend. She had her two teeth redone and they always looked very thick.
Yes, that's common.
Okay. Okay.
It's tough. It's really tough, and it's sometimes it's not just the patient's anatomy. It's not just the dentist's hands. Sometimes it's also what material the lab is using,
Right.
and just being in really having good awareness and a good relationship between the dentist and their lab is also really important.
Okay. And do you subscribe to a certain type of veneer? I've heard of 3D printed veneers.
3D printed veneers are becoming a thing.
You won't want to miss what's coming up. Dr. Branis is soon going to share the smile enhancement option that some consider to be one of dentistry's best kept secrets.
3D printed veneers are becoming a thing. Same with 3D crowns, of course. And I still like the traditional lab made veneers because they can be thinner and stronger and more transparent, less opaque, less chiclet, and more natural.
Back in the day, I remember my mom talking about her crowns, and she said, I hope they never come off because they had to shave all of my teeth down like Dracula. Is that
Ugh.
still the thing?
It is. It is. Seeing your teeth when they're crown prepped, so shaved down and contoured for crowns, is very scary. So, yeah, you do not want to hand the mirror to the patient after the crown preps are done. That is a visual that they will never get out of their mind. But great point in that crowns, you have to shave down more teeth, more tooth structure. So, versus a veneer. A veneer, you're only really shaving down and contouring the front side versus a crown, you're shaving down and contouring 360 degrees around that tooth. So it's like a crown in the back of the mouth, but in this case, it's in the front, and it does look really scary without a crown on. Just looking at your teeth without the crown on. So, but yes, we have to contour more for a crown. So, but the advantage is that it has a lot more retention because it has 360-degree retention and hold. It's very rarely is a front crown going to pop off. Very rarely is a front crown going to crack and fracture. Again, unless a dentist is making them so thin, which we really don't do or see. crowns, you can pretty much guarantee that a front crown is going to stay for a lifetime.
Now, now I'm recalling because I'm thinking of risks. When my son was very, very young, his dentist put, I think it was a crown, and it was on a baby tooth. I don't remember why. And then it popped off at some point, and it was all rotten in there. Is that a risk of crowns, or was that something else that I should not be worried about?
Well, baby teeth are their own thing. And I don't work with a lot of baby teeth, but because they are supposed to fall out a lot of times to make room for the adult teeth, a lot of times those baby teeth kind of do their own thing. They resorb, the roots resorb. They they act differently than adult teeth do. But in truth, underneath crowns, it is very common to, after decades or years of having crowns, it is common for bacteria and decay to seep in under that crown and to start rotting the tooth. And that's really unfortunate because it's pretty difficult for us as dentists to capture that quickly. We sometimes don't see that decay under a crown until it's either too late or it's progressed into being a decent sized cavity under that crown. And most times we just replace the crown, we clean out the decay, and all is good. But there are times that that decay is really sneaky, and it's not yeah, it's not showing itself that easily because a whole crown is on top, and it's really hard to see on X-rays. So it can happen where we can lose the tooth because there is decay under there that wasn't seen. Now, for the front of the mouth, usually we see that a little easier because that decay is just more visible. It's We're able to have really clear vision in those front teeth versus a back tooth. So we can really see all the way around that tooth. And we are just less conservative with front teeth because those front teeth are smaller. If we see any little sign that something is happening under that crown or veneer margin, we're replacing it, or we're really highly encouraging and educating our patients to explain to them that we're seeing something at the edge and we have a feeling that it's seeping in under, and the quicker we act on it, the better chance we have to just take off the current crown or veneer and replace it and still have really healthy good tooth structure underneath.
In what situations would you recommend crowns versus veneers if somebody's really looking for a structural change?
For a structural change, if the teeth are healthy and there's no real decay and cavity, I would definitely say just do a veneer. It's more conservative. You're shaving off less tooth. It's a great option for that aesthetic change that people might want. So less, yeah, way less shaving down. So the patient keeps a lot more of their teeth, of their tooth. And on top of that, they can change an entire look with veneers. So it's an easy choice. Would recommend a crown if the teeth are heavily decayed, meaning there are cavities under there, so the tooth is therefore more compromised. And so definitely then you would want a crown supporting that tooth rather than just a facing a veneer.
Now, as we prepared for this interview a while ago, you shared a third option, which I feel like it's cosmetic dentistry is like best kept secret. I was not even aware of this. Can you share? Beauty Seekers, we so appreciate you being part of our community. If you'd like to have more educational aesthetic content like the one we're doing today with Dr. Pamela Vranis, please subscribe. Stay with us. You're not going to want to miss when Dr. Vranis shares the smile enhancement option that some consider to be one of dentistry's best kept secrets. You shared a third option, which I feel like it's cosmetic dentistry's like best kept secret. Can you share?
A composite veneer is a chairside veneer. It can also be called a chairside veneer. It's very conservative in the sense that, and it's different than a lab made veneer. A lab made veneer, you have to wait for the lab time or 3D printing, which takes time, versus a chairside composite veneer is built up chairside. The patient is there, and you're just adding on composite material to the teeth or the tooth. And it's a great way to have a lot of input from the patient real time. So if the patient doesn't like the shade, you can change it. If the patient doesn't like the shape, you can change it right there and then. It's a longer appointment, but it's very heavily interactive with the patient and it's modifiable. Most importantly, it's they tend to be reversible. So if we don't want to keep them for whatever reason, we can theoretically just bust them off. Versus a lab made veneer, most times there is preparation involved, meaning there is drilling and shaving and contouring done, and that is therefore irreversible. So a chairside veneer can be very convenient for the patient where they want more control and more say in the result. And you can do smaller things and smaller defects changes or larger big effects where the whole composite veneer runs through the entirety of the tooth and it's a less invasive.
Okay. So how do you deal with the shading issue with chairside?
You technique, and shade matching. So you get really creative with using different shades of composite and matching it to the patient and just doing a gradient. So you can be just as accurate with the shade just by using different colored composite.
Can you explain composite? Because I get veneer, you put something on, I get crown, you put it over composite. What is that?
Composite is filling material. It's resin material that we use for nowadays almost exclusively for any kind of filling. So anyone who gets a filling in the back of their mouth, they're getting composite filling material done and placed in there. So it's very strong, it's very durable. And we because it fills teeth and it's used so heavily in dentistry and in the mouth, we started using it in the front in anterior teeth and with really good and high quality composite material plus good technique and good polishing technique in particular, you can make a tooth look beautiful with composite.
Okay. And so what are the risks then with the composite?
Risks with composite versus a lab made veneer, for instance, is that it's a bit more prone to staining. So, because the material has to be so highly polished, if it's not or it falls a little short, it can be a more porous than a lab made veneer. So, because of that porosity, it can then retain a little bit of stain. So it's not uncommon after maybe 5, 10 years of having a composite veneer that it just has to get redone or touched up, finished. So that's not uncommon. But again, it's not a big deal to do because you're starting off with from such a conservative place. But that's the biggest risk. And also just making sure that as that veneer, as that chairside composite veneer gets flushed up against that gum line, that's really thinned out and polished well so that it doesn't irritate the gum. However, that risk does happen with lab made veneers as well. That is a risk for lab made veneers as well. Anything that touches the gum has to be really thin and perfect so that it doesn't irritate the gum, even at a low grade level. So yeah, those are the risks. Other than that, it might be slightly more prone to chipping, but not really. You're kind of just as careful whether you have a composite veneer or a lab made veneer. A dentist will always tell the patient, just be really careful with what you're biting into. That's that's something that you find with both types of veneers.
Beauty Seekers, we are so pleased to be bringing you this educational content on smile enhancement from Dr. Pamela Vranis. If you're finding value, please subscribe. It'll give us the right signals for us to continue to create more educational content for you. So, okay, as I said before, I had two braces twice, and in kind of the clear aligners twice, but we couldn't move these two teeth out because of the bone. What do you think a crown or a veneer or a composite veneer would be? What would you recommend or questions you would ask?
For the canines?
Yeah, they're right behind. It's like one, two, three, four teeth. And they go
Okay,
again.
right behind. That's a great question. And I actually just got that question today. So, depending the uh, on what you're trying to do, because really a combination of things could be desired here. If it's more of a movement to, for instance, a lot of times our teeth behind our canines start to narrow in a little bit. A great option for some could be to first do ortho, first do aligners, take it back to our aligners, to flare those teeth out a little bit and to buy us some room so that we're not adding such a clunky crown and such a thick crown. So sometimes the best outcomes come from a little bit of a few treatment options. Ortho can really help get us there if the movement, if the difference, if that space is bigger. So starting with ortho could be great, and then finishing it off with either a veneer or a crown. Again, just depending on if that tooth is a virgin tooth and doesn't have any bacteria and decay on it, I would stick to a veneer. Keep it conservative. You can always go from a veneer to a crown, but you can't go from a crown to a veneer. So staying conservative would be my best option, as long as, of course, it fits with the bite. There's a lot of factors. The mouth is so small, but there are truly so many factors to consider. But a little bit of ortho plus then prosthesis, so either a veneer or a crown would be my recommended choice. Is there anything that you'd like to share with the BDC community in terms of, if it's someone like me and we're looking just to enhance our smile, any words of wisdom? Absolutely. First and foremost, just have a good relationship with your dentist. I think that's really important. And that's a lot of feedback that I get from my patients, that you want patients to feel comfortable to ask you anything. You want someone who is going to tell you the truth and not oversell you on treatment, and also educate you, give you the facts, the dental facts. I feel like I say that a lot to my patients, that you make up your mind. I will facilitate that, but the first and foremost, like, what you need to know are the treatment options and the facts, the pros and cons to all those options. So I think having that open dialogue with your dentist is the most important, because all your questions will come out. And it also gives the dentist an opportunity to get to know the patient, because the more the patient talks, the more the dentist understands the true concern and the true source of what the patient is desiring. So having that relationship, it's an intimate space, it's an intimate field. It's very based on trust. It's very much based on trust. And it goes both ways.
Well, oh my goodness. I know we just scratched the surface today on different techniques for enhancing a smile, and you've taken us through a lot. And thank you so much for sharing this best kept secret. These composite veneers chairside is just an amazing, approach that I wasn't completely aware of. And I'm glad I am, because now I'm going to go to my dentist and walk in and say, Dr. Vranis gave me some information.
Absolutely. My pleasure.
Yes, thank you so much, Dr. Vranis. You are a gift to the beauty seat community. Thank you for your time.
Thank you.